Hello, this is Jennifer Thomas. I'm doing my oral presentation for English composition. This is my audience. My son Tyler, no that's not my son, my brother Sean, my mother Joanne,
Hi,
and my husband is videotaping. So my presentation is on pediatric nursing, aptly titled, So You Would Like to Be a Pediatric Nurse. I'd like to start with a story that my friend Laura told me. Laura is a pediatric nurse on 4th floor of Strong Memorial Hospital. She recently had a patient named Josh, who was a very sick little boy, but they had a great relationship. He never complained. He was just sweet as could be. And she came in one day to say hi to him at the beginning of her shift, and she started to joke, and she realized something was wrong. He went very pale, and he said, "I don't feel good." And he fell back against the bed, and all the monitors started blaring. She realized he wasn't breathing. So she started CPR while calling the code team, and then the mother came in while he was being resuscitated. And so she was explaining to the mother what she was doing while she was resuscitating him. A minute or so later, he started to breathe normally, his heart was beating fine. Physician came in, she explained to the physician what had happened and what she thought needed to happen now. She calmed the mother down. Now, as scary as this story is, it's what she deals with on a daily basis, being a pediatric nurse. So, now that you've decided that pediatric nursing is right for you, we need to decide if you are right for pediatric nursing. So let's talk about what a pediatric nurse does on a daily basis. A lot of what they'll do, first of all, they have 2 to 3 patients that they are caring for at any given time that they need to be monitoring their vital signs, which is their blood pressure and their temperature and their O2 saturations. And not only are they looking for those values, but they're also looking for changes or trends in those values. When they notice a change, they alert the doctor, who will probably want to perform some sort of diagnostic test to figure out what's going on, and that will be your responsibility to do most of the time. Once the test results come back, the doctor will probably prescribe some sort of medication or some sort of therapy to try to remedy the situation. That will also be your responsibility. So, some attributes a successful pediatric nursing nurse needs to have. The first and most important, I believe, is empathy. The ability to empathize with your patients and their families is key. Another story, actually from Laura, is she was trying to explain the upcoming surgery of one of her patients to his mother, and she was just sitting there, eyes were glazed over, she didn't look like she was really getting what she was saying, and it was important information and she needed to have. So she wondered, how can I get her to understand? So she put herself in the mom's shoes, and she realized the mom was scared. And that made her more able to relate to her on a more personal level and relay the information in a way that she could gather it effectively. The next thing that you need to do is you need to be an advocate for your patients. Most of them are too young or too sick to tell you what they want, what they need. The parents most likely will be too distraught to ask all the proper questions, and they may not know them. With your medical background, you have a better chance of knowing the questions to ask. It is your job to question the doctor if you feel you need to. Make sure that your patient is getting the right care and the right plan of action for him or her. As we saw from Laura's first story with Josh, the ability to remain calm is also a key attribute. If she were to have panicked, the mom might have panicked, she may have gotten in the way, revival may not have been possible, all sorts of things could have gone awry. But with her calmness, everything went fine, and Josh was revived. The next attributes, analytical thinking, it means like let's say you get the results back and you notice that one of the values is a little high. You need to be able to decide, is this something the doctor needs to know? Or was it because, oh, he's on this medication that can cause this value to go up? Or he ate this kind of food and that can also make the value go up. If you had just called the doctor and said, oh, his value went up, and the doctor said, well, it's because of his medicine. You wasted his time, you wasted your time. So if you can figure that out ahead of time, you'll save everybody some hassle. The ability to work well with others is also something you need to be able to do. Most patients need an individualized care plan, and you're going to be making up this plan with a physician and maybe the respiratory therapist, the physical therapist, and all sorts of other healthcare professionals. If you can't work well with them, the care plan will suffer. Organizational skills will help you be able to multitask. When you have 3 patients and they all need different things, you need to make a plan as to, okay, well, Joey needs ice, so I'll get that on my way to get Kara's medicine, and while I'm filling the medicine, I'll call Joey's doctor, and you have to make sure you get it all done in a timely fashion and in a way that makes sense. The final attribute is the ability to teach patients and their families. Most of the time, when patients go home, they're still pretty sick. They're no longer in life-threatening danger, but a lot of times they're still pretty sick. So the parents need to know what to look for, how to care for them, maybe how to dress a wound or change a drain or any sort of thing. The children also need to be aware of their condition, what they can do, what they can't do, what they shouldn't do. So now we've decided you want to be a nurse. How can you go about doing that? There are a few paths you can take. The first one is a diploma program. It's kind of out of date, but it's more of a kind of throw you into a hospital setting and you kind of learn on the fly type of deal. It takes 2 to 3 years. Like I said, most people aren't doing those anymore. Now, more often is a 2 or 4 year nursing degree. 4 year is preferred, is a more well-rounded educational experience. A 2 year degree is just nursing. 4 year degree, you take electives and things that will help you just be a more whole individual in your profession. English, psychology, sociology, all of those things will help you. Once you get your degree, you need to pass the NCLEX licensure exam. Everyone needs to have it in order to be a registered nurse. What this exam does is it measures competencies that you need to perform safely and effectively as a newly licensed entry-level nurse. The job outlook for nurses is excellent. The forecast is faster than average, 26% over the next 10 years for job growth. Also, the risk of being downsized is very low. Because there is such a shortage of nurses as it is, they're not going to want to get rid of you if you're doing a good job. So you should be quite stable. There are some career advancement opportunities. Most floors need a charge nurse or a nurse leader. You can also go back to school for your master's degree to become a nurse practitioner, which is almost a doctor. You can diagnose diseases, measure, prescribe medications, and be a provider of care for most people. They don't actually need a doctor if you're a nurse practitioner. Also, you can join groups like the Pediatric Critical Care Colloquium. There's a great networking opportunity. Benefits, if you stay in the hospital setting, most likely are a 401k retirement plan. Most places will match you up to a certain percentage. Some privately owned institutions will offer pensions. Most will offer affordable health insurance for you and your family. And some, like the University of Rochester, offer tuition assistance. Some final thoughts on pediatric nursing. From what I hear from my nursing friends, Always going to be sick people. You will always have a job. Thank you very much.